Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. As always, my guest this week is Fran London. Hi, Fran.
Hi, Chuck.
For those of you that may not be familiar with Fran, she is the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book No Time to Teach, which was the 2010 American Journal of Nursing Book of the Year. Is that correct?
Yes, it is.
Cool. And a lot of the topics that we talk about come from the book, but we're going to talk about one today that has come from the pages of the newspapers and the research journals and things of that nature. And before we get into it, I want to say a brief hello to Diane in Columbus, Ohio. She is a patient education specialist up at one of the hospitals in Columbus, and she sent me a nice email the other day saying that she enjoys our show, and so it's good to know that we have a listener.
It's good to hear. We'll take more of those.
Yeah, absolutely. And I'll say to Diane and anybody else that watches the show, by all means, if you would like to hear some different topics, or if there's something you'd like us to go into more detail on, please send either Fran or I an email or comment on either the blog posting or the YouTube posting, because we're more than happy to try to do everything we can to provide things that you want to listen to that would be beneficial to you as patient educators. So thanks, Diane, for writing.
Thanks.
Now, today, Fran, we're going to talk about digital technology. One of us, I don't know if it was you or me, found a report called Technology Beyond the Exam Room, How Digital Media is Helping Doctors Deliver the Highest Level of Care. And this report focused on what they called high-tech communication, that meaning email, text messaging, and voicemails. Well, as long as those have been around, I'm not sure we'd call them high-tech anymore. But there were some interesting findings. The first one was 85% of U.S. healthcare consumers feel that these types of communication, such as email, text, and voicemails, are helpful, if not more helpful than in-person or phone conversations with their healthcare provider. Number two, 1 in 3 U.S. consumers says that receiving text messages, voicemail, or email that provide patient care between visits increased their feelings of trust about their provider. And then the third one is, of the 66% of patients who have received a voicemail, text, or email from a healthcare provider, 51% reported feeling more valued as a patient. 35% said the digital communication improved their opinion of their provider. And a third reported feeling more certain about visiting that healthcare provider again. So all of those things sound good to me. Why don't you kind of give us your take on this and tell us, what does the research say? What are you seeing?
It's a lot of question there. Basically, I think it's interesting in that the alternative is usually either getting a phone call from the doctor or no message at all. And since phone calls really don't happen, at least in my experience, very often, getting something is better than nothing. And emails, text messaging, and voicemail are pretty familiar to everyone, at least even if they don't get text messages, they know about them. So I think these are basically adding familiar communication systems that are more convenient for healthcare providers, because phone calls, you have to connect. And here, it doesn't have to be in the same time.
Yeah, there was some research done by AT&T some years ago on the number of, at least in the business world, the number of phone calls that actually connect the first time you call somebody, and it's less than 20%. And so we wind up getting voicemail. And so I would agree with your assertion that this may be more convenient. To tell you a quick story, a couple of years ago, my mother had an allergic reaction to something. We didn't know what. Took her to a regular doctor, and he had trouble diagnosing the problem, gave her some medicine that she didn't respond to it really well. So I took her to an allergist. And the allergist did an investigation, and then she gave me some instructions. She said, I need an inventory of everything your mother has access to in terms of ointments and soaps and all that kind of stuff. And she said, send it to me via email. Well, that's never been her. I've never done that before, so I was thrilled because that made it convenient to me. So I created the list, I attached it to an email, and she responded back to me and circled the ones, or at least highlighted the ones that she thought might cause a problem. And so I removed those from my mother's ability to get her hands on them, replaced them with something else. And, over the course of the next couple of weeks, the doctor and I exchanged 3 or 4 emails, which I found just incredibly helpful. It eventually we got the problem solved and the problem cleared up, and it was wonderful. So from a personal experience, I found it great that she would take the time to do that. So I totally understand that it's great. So I guess from a standpoint of, if I ask you the question, in your opinion, why is it working? It's because it's something that's part of our daily lives now, right?
Yeah, and communications are better than no communications, and it improves the connection, the feeling that they care about you, and that you're valued.
Yeah, I totally agree with that. And then the research seems to support that. Now, I will tell folks that this research was done by Televox, Televox, and I'll put a link into it. I don't know how big the sampling was or any of that information, but it's fairly compelling. Now, what would you think are some of the, I know you've looked at this, what are some of the best practices that you would recommend to patient educators in doing this?
Well, one thing that's been researched quite a bit in patient education is texting.
Mm-hmm.
And there are 2 reasons to do that. One is to either spread information, and the other is to enhance adherence, to help remind people to do what it is they have to do. And texting can be signed up for. So if you want to get these messages, you can sign up for them. If you don't want them, you can unsign up. So it really is a mutual agreement, which is nice.
Yeah, and we actually talked about one of these where there was an activity that was done where they sent a reminder every day to the patients to take their medicine, and then they also started adding additional education to that. And one of the comments that I had for you on that was, I don't know if it's just me, but when I sign up for things that I get daily, after about a week, I ignore them because it's too much. Am I alone in that, or is that fairly common?
I have the same experience, especially when it's newsletters or information like that is not essential to my functioning.
Yeah.
Just extra information. So I just tune them out, and then at some point I often actually discontinue them because I know I'm not looking at them.
Yeah.
But if it's something like a medication that could, like an asthma medication or diabetes, blood checks, if it's something that's essential, that's a reminder that you really do want to do, but you actually do forget, it might be helpful, and it might not have that same effect of wearing out over time.
Yeah, and I would agree with that those types of reminders make a lot of sense to me, because I think we've talked before that there's a ton of research that says that many patients, once they leave the hospital, once they start to feel a little bit better, they quit taking their medicine, and that's the wrong thing to do. I know me personally, when I get on a new medicine, I will set an alarm for myself to remind me, but I suspect that not all people will do that. Okay, we're back after a brief technical difficulty. Fran, talk to us a little bit about some of the different uses of text messaging.
Well, they've been used for a while now by the government in public health interventions. One is the quit smoking line, which is smoke-free text, that you can get text messages reminding you not to smoke, encouraging you for not smoking, giving you tips. And then there's text for baby, which is when you're pregnant, you can put in when you're due, and it'll send you appropriate messages every day about what you can expect, what's going on, what your experiences could be, resources.
Okay, interesting. Now, there was also one about teens I remember reading about.
Well, there was a study where they actually text message teens who agreed to participate with healthy nutrition tips and talking about foods. And they were actually very receptive, and they found that it improved their diets.
Well, that makes sense because the options that they tend to migrate to are drive-throughs,
Right, right.
and that's not always the healthiest
But
option.
it was functional. It worked.
Yeah, well, I know that my kids are no longer teenagers, but they grew up in a technology world, and texting has always been their method of communication. My wife hates that because she'd rather talk on the phone. And you can tell when she gets a text message, she says, "I do not want to respond in text." I said, "Well, call them.
Right.
It's okay. They will talk to you, but they just won't initiate the call."
And you know that they're receptive at that point in time.
Yeah, absolutely. Absolutely. Yeah, sorry about all the freezing that's going on. We'll correct as much of this as we can after the fact. Let me ask you this. Is there anything that our patient educators should think about as it relates to using text and voicemail and email if they're doing none of that right now?
Well, I certainly think it would help to be familiar with what's available out there already that people can sign up for, so that if you have a patient population with who's pregnant or who's trying to stop smoking or whatever, you could refer them to that option for assistance.
Yeah.
So that's the easiest way to deal with it.
Okay. All right. Okay. I appreciate your input on this today, and I'm going to put links to some of the research studies and articles that we both found, and I'll put those in the show notes so that folks can take a look at those. And then we will think about doing a one or two other episodes, perhaps on implementation or resources that we found that you can work on with this. And then in perhaps the next episode we're going to talk about an article that was in USA Today recently about discharge instructions. And there's some very interesting information, stuff that you and I both say, yep, we know all about that. But it's just now at least bubbling to the popular communication right now. So with that, I'm going to thank you for your time and then ask you to tell folks how they can find you online.
Sure. I've got a blog at notimetoteach.com, and I'm on Twitter every day at notimetoteach.
Okay, cool. And if folks are interested in your book, it's available wherever books are sold. You can get it in ebook and paper form. And if you are interested in using the book for group teaching, you can get a discount from the publisher, and the publisher is Pritchett and Hull, and their web address is p-h.com. And if you want to call them, you'll find the phone number there, and you can call, and you get a handsome discount on a group purchase, or bulk purchase, I guess it would say. And if you happen to be interested in learning more about video on demand for patient education, you can check out our website at synergybroadcast.com, or you can Google MMDS, which stands for Medical Media Delivery System. So, Fran, thanks very much for your insight and input today, and I look forward to talking to you next week.
Okay, bye, Chuck.
Bye-bye.